I'm Bruno Bergmans, Vice Chair of the MDS Young Members Group Steering Committee, and I'm here to interview Federica Arienti from Milan in Italy about her work, which was recently elected as an MDS Young Member Research Highlight of the Month for November 2024, and it was published in Movement Disorders Clinical Practice. And one of the most frequently asked questions by relatives in the PD clinic is whether Parkinson's disease is a genetic disease. And your impressive collaborative effort aims to shed more light on this important issue. What is the take-home message of your study?
Almost one-third of the population in the study recognized at least one relative with Parkinson's disease. We were quite shocked when we studied this data because we, yes, expected more frequent percentage of patients with positive family history, but not such a result like this. And also genetic forms were more frequent than previously thought. Also, in the sporadic cases, not only in the familial cases, genetics findings were quite strong. We have to better study pedigrees of PD patients' families because, yes, some forms are genetics, but there are other forms which clearly have a family history, a positive family history without a genetic diagnosis, and this could be overwhelming for the patients and its relatives, but also for the clinicians, especially now that we have more pharmacological studies on specific PD mutations.
I find indeed that the most surprising result from your work was that the prevalence of the pathogenic variants in the most common PD genes did not differ between sporadic and familial Parkinson's disease patients. I found it very surprising. And do you have an
Yeah.
explanation for that finding?
We initially expected some differences between the two groups, obviously, but no, this was the result denied this expectation, and also dominant forms like two or something like that, which resulted both in the familial and the sporadic cases without any statistical significance or value was surprising. So I think that the penetrance of genes could partially explain this. And also the phenotypical manifestation of some genes can be very different. And I think that more profound study and more in-depth study is needed for discussing this item, which we do not expect it, however, at the beginning of the research.
Did you check also whether there were many de novo mutations in these autosomal dominant genes in the sporadic patients?
Yes, in sporadic patients were prevalently de novo mutation. Not in all patients this data was available because obviously you have to test parents and not always this was done. But yes, there was a difference in de novo mutation, but still not statistically significant.
Do you think this frequent finding of a genetic background in the sporadic patients that should change the way and to which patients we offer genetic testing, especially in the sporadic patients?
Yes, this was our conclusion since genetic variants were discovered both in familial and sporadic PD cases. Yes, with some differences and obviously with a more frequent genetic cases in familial forms than in sporadics, but still 25% of patients which undergo a genetic test in the sporadic forms resulted positive. So this is a huge result. I think that genetic tests should be offered, if possible, to all patients with PD.
And given the results of your study, how do you now counsel patients' relatives asking whether there's a familial component to the Parkinson's disease in their family that could increase their own risk?
Yes, this is a problem, and often relatives are unaware of the familial risk of PD. They simply do not know, do not expect. It's difficult to counsel genetic tests in many situations. If the patient is young, almost everyone suspects of something, but if the patient is in their 60s or 70s, it's unbelievable for some people to have a genetic background. I start talking about what we know. So, okay, 5% of monogenic forms, but there are risk factors. Not everyone could be involved in these, but is still a major risk for your relatives and your parents, and be clear and answer your the patient's doubts and questions, but also the relatives' doubts and questions.
Yeah. And the study was a huge undertaking. Would you like to share what were the resources and the strategies that helped in this work?
This study was very huge and involved 28 centers in Italy for the first time. And as a young member, obviously, I was a little bit overwhelmed by all the problems and the skills that have to be put in it: cooperation, coordinations, and team management. But at the end, this was very surprising collaboration, which enforced our partnership in order to have the possibility to discuss and to reflect on some results. This was very interesting also because in Italy is not a big country compared to others, but there is a diversity between the regions. And sometimes it is useful to uniform the way of studying and reflecting on a disease. Every center perform different way of analysis, different kind of techniques, different genes. So I think that to have clear results, we have to collaborate, cooperate, and unifying where possible our way of treating the disease and sharing results. And there were many young residents also who participated in these studies, and so this was still a very good thing. So very exciting.
I would like to thank you very much for sharing the highlights of your research with us, and we are already looking forward very much to your follow-up papers. Thank you very much, Federica.
Thank you.